Dear students, the today's practical is to study the anti-ulcer activity in rat models. See, according to the space, according to the area where the ulcer is present in GI tract, it have its own name. If it is present near to the esophagus, it is called as esophageal ulcer. If it is present into the stomach region, it is called as gastric ulcer. And when it is nearer to the duodenal sphincter, it is called as the duodenal ulcers. Whenever the erosion of skin is deep one and which cause transfer the gastric content from one way to another from one side to another side, it called as the peptic ulcer. The aim of today's practical is to study the anti-ulcer activity of drug using pylorus ligand rat model and NSAIDs induced ulcer model. What is peptic ulcer? It is one of the most prevalent chronic gastrointestinal disorders. It is a sore that develops on the lining of esophagus, stomach, or small intestine. It is more common in middle age to older age. The site, it may be nearer to the duodenum or in stomach, and the ratio of duodenal to stomach ulcer is 4:1. The ratio of prevalence of peptic ulcer in male as to female is 3:1. The lifetime prevalence of peptic ulcer is 12% in men and 10% in women. Now we will see the pathophysiology of peptic ulcer. In the developing of peptic ulcer, there are two factors are there. One which is called as aggressive factors and second one which is called as protective factors. Aggressive factors, these are the factors whenever increase it cause the peptic ulcers. Whenever the protective factors are balance the aggressive factors, there are very less chance to develop the peptic ulcer in human beings. What are the aggressive factors? These are such as acid, pepsin, non-steroidal anti-inflammatory agents, Helicobacter pylori infections, consumption of alcohol, smoking habits, stress, and consumption of spicy food. These all are the aggressive factors which aggravate the peptic ulcers, or which these are the factors which responsible to cause peptic ulcers. Now protective factors. The protective factors are mucus, prostaglandins, mucosal blood flow, and bicarbonates. See, both these aggressive and protective factors are need to be in balance. If it is in balance, there are very rare chances to develop the peptic ulcers. But wherever the aggressive factors are more as compared to the protective factors, so the chances of developing peptic ulcers will be increased in human beings. A peptic ulcer is a sore that lining the digestive system, and according to the area where the sores are present for the peptic ulcers, it have its own name. Suppose that if it is present in esophagus area, it is called as esophageal peptic ulcer. If it is present in stomach, called as stomach ulcer. If it is present nearer to the duodenal, called as the duodenal ulcers. And if it is deep one and transfer the gastric content to the peritoneal cavity, it is called as peptic ulcers. So whenever the food entered into the stomach, the peristaltic movement of the GI tract resulted into form a small tiny bolus of food material, and thereby it enters into the intestine where it gets absorbed. The protection to the gastric juice is done by the mucus layer for the stomach cells. Whenever the mucus layer is destroyed and the acid is directly come in contact with the GIT tract, there is resulted in peptic ulcers. The another way, if the persons are having H. pylori contaminations with contaminated food or water material, it cause peptic ulcers. That uh, H. pylori is entered within GIT tract, and then deep down it present in a mucus layer. When the colonies of H. pyloris are increased, it cause destruction of mucous membrane, thereby it increase the contact of gastric juice with a stomach wall and hence cause the peptic ulcers. In another way, whenever the persons are taking the non-steroidal anti-inflammatory agents for the longer time durations, at that time also they cause destruction of a mucous membrane, and hence it is again resulted into the peptic ulcer. The suitable animal model for the screening of anti-ulcer activity is rat, because the continuous secretion of acid is there. Glandular portion of rat stomach analogs to the body of stomach in man, both anatomically as well as functionally. Being omnivorous resembles man nutritionally. The guinea pigs are used when histamine is used to induce the ulcer. The induced ulcer and in vitro assay can be possible. That's why the best animal model for screening of anti-ulcer agents is rat. The pylorus ligation rat model. The principle behind that is the pyloric ligation in rat leads to accumulate gastric acid in the stomach, leading to acute gastric ulceration. The requirement for the experiments are albino vista rat of weighing in between 150 to 200 gram, the drugs, that is ether, which is required for the anesthesia, saline solution which used to treat the control animal, omeprazole, which is used as a standard anti-ulcer agents, and the taste drugs. If the single taste drugs is used, then we can use the different concentration of the same drug, or either different drugs can also be assayed. The procedure for anti-ulcer activity is rats are fasted for 24 hours prior to pyloric ligation. They are randomly divided into 5 groups of 3 animals each, such as group first is for control animals which treated with saline solution. Group second is treated with standard drug. Here we are using the omeprazole as a standard drug. Group third is the first concentration or say lowest concentration of drug use. Group 4 is the medial concentration of test drug, and group 5 is the highest concentration of test drugs. The drug administered once for 2 days, and 30 minutes prior to the ligation. For treatment, the drug can be given by the oral gavas, or which is also called as per oral dosing. For that purpose, we can utilize the specialized type of needle called as oral gavas, which is connected with a simple disposable syringe. It have a quite curve towards the end, and it is inserted into the rat mouse in a such a way that it should not be entered in a respiratory system of animal. It need to be easily inserted into the esophagus, and when it enters in esophagus, at that time we can give the optimum dose to the rats. Afterwards, the rats are anesthetized with ether, and the pylorus ligation procedure was done. The surgical procedure is need to complete. Animals were kept in separate cages for the recovery. After 19 hours, animals were sacrificed by decapitation method, which is also called as cervical dislocation method, and then after, again the stomach of rat is isolated, it is cutted down, the gastric content is separated and kept aside, and which is assay against the one normal NaOH to find out the acidity. Along with that, the stomach is placed over the plain paper to find out the ulceration in a gastric mucosa. See, here we can see how the procedure is to be done. First, the rats are anesthetized, it kept into the dissection box. The cut is given to the abdomen, and we need to find out the stomach first. See, with the help of forceps, we need to find out the stomach. See, once we are find out the stomach, we need to open it, and then after, as we know that to the one side it connected with the esophagus, and to the another side it is connected with the duodenum. So we have to identify the connection of stomach with the duodenum, and here is the point where we need to tie it with the help of, see, this is what about the pylorus end, and at this end we can tie it with the help of thread. So when we are tie it with the help of thread, at that time it cannot pass the content of stomach into the duodenum and the intestine, so it stay as it is into the stomach. And again, once the knot is given, at least 2-3 knot need to be given to the pylorus end so that it cannot get open, and again the stomach is need to be inserted through the cut which is already given to the abdomen like this, and the stitches are given, and animals are kept in a cage for 19 hours, and then after, again the same procedure need to be done, and the animal were sacrificed. After 19 hours, the animals are again anesthetized with light ether, and then after, the anesthetized rat is kept into the dissection tray, Then the abdomen was opened and the stomach is dissected out. The content of stomach is collected in centrifuge tube, and then after it need to be centrifuged, and the supernatant need to be assayed against NaOH so that we can find out the acidity of gastric content. The stomach is open along with the greater curvature, and we need to find out the ulcers by visualize it under the 10x magnification power. The ulcer index is calculated as the total mucosal area which is affected by the ulcerations. The ulcer intensity can be given as a score, such as 0 score is given to the normal stomach skin. If there is superficial mucosal action, then we need to give score 1. If deep ulcer will be there, it is score as 2, and if it is penetrated or perforated ulcer is there, we need to give the score 3 for that. The content of stomach is analyzed for its volume, pH noted by pH meters, and the free acidity and total acidity, which is find out by using titration. The titration of the solution is need to do against 0.01 normal NaOH, which is done by using Topfer reagent, and phenolphthalein used as an indicator. Volume of NaOH, which turns the solution to yellowish orange, corresponds to free acidity. Titration is continued till solution turn pink. The total volume of NaOH used up corresponds to the total acidity of gastric content. The acidity milliequivalence is find out as volume of NaOH is required into normality into 100 divided by 0.1. Mucin and prostaglandin levels can be estimated to detect the cytoprotective effect of the taste drugs. What will be the incidence? Inference will be the ulcer index of taste drugs compared with the control group to detect anti-ulcer effect of taste drugs. If present, it is compared with the standard group. Other parameters help to infer the mechanism of ulcer protection. For example, decrease in volume, free and total acidity, which gives idea about anti-secretory actions. Rise in pH gives idea about the acidity of gastric content. Increase in mucin and prostaglandin shows the cytoprotective activity. Now the next model, that is NSAIDs induce gastric lesion. The gastric ulceration is produced in rat by certain drugs. The ability of the taste drug to protect against the ulceration is need to observe. NSAIDs used for such type of model are aspirin, indomethacin, ibuprofen, etc. The principle behind NSAID induced gastric lesion is inhibition of endogenous prostaglandin production and consequent loss of gastric mucosal defense. Important model for identifying drugs that could be effective in NSAID induced gastropathy. The procedure is rats need to be fasted for 24 hours in separate cages and randomly divided into 5 groups, such as control, standard, test drugs are administered once daily for 2 days and 30 minutes prior to the administration of ulcerogenic effect. Ulcerogens administered by oral gavas. Rats sacrifice 4 to 6 hours later. Ulcer index analysis of stomach content here. The evaluation is done just like that of the previous. The score is given to the stomach skin. If there is no ulceration, the 0 score will be given. If there is superficial ulceration, the score 1 is given. If there is deep ulcer, the score is assigned as 2, and if perforation is there, it is given score as 3. Dear students, now I will see the multiple choice question for anti-ulcer activity. The first question is, what is the function of somatostatin? The options are inhibit histamine and gastrin releasing cell, activate histamine and gastric releasing cell, inhibit histamine and its secretion, ensure histamine and its secretions. The correct answer is option A, that is inhibit histamine and gastric releasing cells. The second question is, which of the following receptor is closed by drug during the peptic ulcers? The options are A. H1 receptor, B. H2 receptor, C. Proton pump, D. H2 and proton pump. The correct answer is D, that is H2 and proton pump receptors. Question 3. Which of the following drugs are H2 antihistaminic 1? The options are cimetidine, omeprazole, pyranzapine and misoprostol. The correct answer is A, that is cimetidine. All the drugs like cimetidine, ranitidine, formatidine, these are belong to the H2 antihistaminic agents. Next question is, which of the following drug is proton pump inhibitors? The options are cimetidine, omeprazole, pyranzapine, misoprostol. The correct answer is B, that is omeprazole. All the omeprazole, lansoprazole, these are the drugs, those are belong to the category proton pump inhibitors. Which of the following drugs are anticholinergic agents? The options are cimetidine, omeprazole, pyranzapine and misoprostol. The correct answer is C, that is pyranzapine. Which of the following drug is antacid? Examples, options are cimetidine, omeprazole, magnesium hydroxide and misoprostol. The correct answer is C, that is magnesium hydroxide. Next question, which of the following drug are ulcer protective 1? Options are cimetidine, sucralfate, magnesium hydroxide and misoprostol. The correct answer is B, that is sucralfate. Which of the following drug is anti-H. pyloric agent? The options are cimetidine, amoxicillin, magnesium hydroxide and misoprostol. The correct answer is B, that is amoxicillin, because the H. pylori infection can be irradiated with the help of antibiotic like amoxicillin. The next question, which of the following is a mucoprotective agent? Options are cimetidine, amoxicillin, sucralfate and misoprostol. The correct answer is C, that is sucralfate, because The ulcer protective agents are also called as mucoprotective agents. Which of the following is correctly defined a peptic ulcer? The options are: when the esophagus start getting thinner, when it begins lesions to the gastric mucosa, C, when upper esophagus get lined by red colored tissues, and D, when lower esophagus gets lined by the red color tissue. The correct answer is B, that when begins lesion on the gastric mucosa.